We're here with Craig Rusin today, who has just got done doing our presentation, or one of our lunch and learns, and really talking about predictive modeling. So I've got a few questions for you as we go forward. Healthcare is really kind of changing now, and we see about 90% of healthcare is really done outside of the hospital setting. How can we take what you're talking about, that you're doing great things within the hospital, and move that towards an outpatient center? For example, monitoring diabetic patients in their home to keep them out of coming into the emergency room when they have an event.
That's a great question. I think that part of the change that's happening inside a hospital is device integration. So now we're seeing a lot of devices being connected into a central repository and then surfacing that data for new and novel things. So I think what's going to happen is something similar has to happen in the home space, where the devices that are at home have to be connected to either some sort of cloud-based system or some sort of system that allows that data to be transferred into the hospital setting in order to make that data useful for the purposes that you were describing.
Great. So over the last 5 years, we've spent about $52 billion on EHR products. But EHR products collect data. They really don't do the predictive modeling. How do we get stuff that you're developing kind of either incorporated into the EHR so that the doctors see predictive things versus looking at thousands of pieces of data on what happened in the past?
So I think part of the challenge with predictive analytics is that you need a very good representation of the state of the patient over time. And part of the challenge with EMRs is that it's very difficult to record all of that information. So for example, a typical monitor will generate over 800,000 measurements per hour, and yet only maybe a dozen of them or so get into the EMR every hour. The other 870,000 are extremely valuable, and we need a system to be put in place in order to capture all of that data so that you can then leverage it for predictive analytics and other goal-directed therapies. So I really see those sort of functionalities as a complement to what's going on in the EMR, so that you can figure out what part of the data set that the patient is generating is important, and then only put that piece of data into the EMR for record keeping and billing.
Well, great. I want to thank you very much for speaking again, and hopefully people will be able to find a lot more information about this on our website in the near future.
Thank you very much. It's a pleasure.